I would like to introduce Dr. Nanaz Pirnia. She is a psychotherapist, a neurotherapist, and an educational psychologist in private practice in over 32 years. She has been a consultant to many schools, including the Beverly Hills schools. Nanaz is specifically involved and experienced in working with children and adults who have behavioral, emotional, social, psychological, or educational problems. Welcome, Dr. Pernia.
Thank you so much, Gaida, for having me. And I say hi to everyone, wherever they are. But it's a pleasure to be, and thank you for the invitation.
Pleasure here as well. Let's start with the questions. We would love it if you can tell us about your innovative and life-changing new scientific discoveries and technology about the brain.
I'm really excited to share this new scientific and honestly life-changing technology that I have added to my practice as a psychotherapist. I've been in practice for over now, it's 38 years. And about 20 years ago, I was lucky enough to meet one of the founders and creators of HEG neurofeedback. And I realized that we are truly a victim of our brain cells. And in psychiatry, in psychology, and overall in mental health practice, they really forgot to think about the brain and the brain responsibility for our body. So with the new latest technology and discoveries of the 21st century about the brain, we have started in the field of neuroscience. Neuro means brain. And the neuroscience, and you keep hearing about the brain recently. I've been in this field for 20 years, and it's the missing link to psychotherapy, psychiatry, and all the field of mental health. And right now, as a psychoneurotherapist, we are extremely successful in understanding the underlying cause of people's problems. So if you have any emotional, psychological, learning, any behavioral issues, if you have weight issues, if you can't sleep, all the diagnoses in the book of psychology from A to Z, these are only symptoms and not disorders anymore. And we do not want to mask it necessarily by having medication, psychotropic medications as our first choice. So it's almost like the world of neuroscience and neurointegration therapy is a blessing and a fantastic knowledge and a fantastic success to balance the brain and the body, because brain and body now we know that they're not separate entities. So brain and gut are actually the pathway in constant communication for us. So with what we have gathered together in Mind Therapy Center, with the help of functional medicine and neuroscience, which is complementing psychology and mental health, we've been able to diagnose properly and not mask problems, and then have an ability with neurointegration therapy and functional medicine to treat the patient, kids or adults, it doesn't matter, for a better brain.
Interesting. And could you please tell us about the two new breakthrough knowledge, the neuroplasticity and the epigenetic, that is changing the way you are diagnosing and treating the brain?
Absolutely. We have two breakthrough new knowledge about the brain. Something interesting for everyone is to know is that the brain when you go outside, light travels through the skull. So, and it gets light up. And with that knowledge, we started to have a lot of different machines and technology like MRI, functional medicine, SPECT, PECT, and then QEEG to understand the responsibilities of all these 19 areas of the brain cells. And we also learned that brain is neuroplastic, meaning that with the right attention, brain can change, the cells can adapt, the cells can rewire, reconnect, and bring new neurons to our brain cells. So the knowledge, the previous knowledge, which unfortunately is still in our books, is that brain is static. It cannot be rewired, and it cannot be changed. This is false. And this is the best news I'm sharing with your audience, that from birth throughout our lives until we die, the brain cells with the right attention and care and the way we live can change and bring new neurons. Therefore, we can get rid of our symptoms. And I want to tell you that neuroplasticity is a new way that we look at the changing brain. So if these are symptoms, and if we know they can change with the care that we're going to share with the audience how we do this, then medications and all these people, in America, 70% of the people are using at least one type of psychiatric drugs. So mind-altering drugs. And the statistic shows that Americans are using as much drugs, medications, as all the Europe and other countries in the world. And this is really not necessary anymore. We can really diagnose why we have a symptom. We can understand where we have a problem, and neuroscience and the neurotransmitters, and therefore neuroplasticity, can show us that electrical activity, brain gem, and checking the nutrients of the brain is the key to rewire, reconnect, to have a healthy, happy brain and life.
So, Dr. Pernia, could you please give us an example of neuroplasticity and this new knowledge, like an example of patient, for example?
So when I see a patient, and let's say from easier common problems such as anxiety, depression, ADD, ADHD, sleep issues, to more complicated ones such as schizophrenia, autism, OCD, bipolar. These are all translated to the brain cells. And it shows us that the brain in the 19 areas, I can actually share with you the brain locations. So if this is the brain, now we know that each area of the brain is responsible for something that we do, we say, we think, and we feel. So the management of the whole body depends on a balanced brain. And as you know, when we're born, nobody is really balanced. It's almost like taking care of your teeth. When you go to a dentist, it's not because necessarily you have an infection or a pain. You're going for prevention. So neuroplasticity is helping us to understand that if we work out the brain cells reconnect and rewire for us. And we are not a victim of our brain cells. And we don't necessarily need medication, psychotropic medications for the rest of our lives. And as a matter of fact, if people take these psychotropic medications for too long, it's going to affect the structure and the wiring. It interrupts the wiring of the brain. So for teenagers and kids, when we interrupt the wiring, the brain is not going to have the potential or the opportunity to prune and mature to the front of the brain. So neuroplasticity means this is symptom, this is not a disorder, and there is a reason for it in the brain, and with the right attention, since the brain is not hardwired or fixed, we can correct the imbalances.
There was a fascinating story you told me earlier, if you can remember, about a person on a wheelchair and was told that will never walk. Can you please tell us the story again?
You know, one of the major accomplishments of neuroscience for me and for a lot of doctors that they decide to go back and learn about the brain, because it's a very complicated field. And anyone who's a graduate of any university, even our neurologists, anyone in the field of brain, if they don't go back and learn about the new technology and the scientific breakthrough, they won't be able to practice it. One of the things that I have a dear doctor that we work together, she lives in Toronto. She's doing a fascinating job with kids with cerebral palsy. So what happened is that the same way that the brain is neuroplastic and with the right attention, it changes and it becomes a whole, we realized that in every month of our lives when we're born, there are possibilities developmentally for the brain. And if we deny the person of that possibility, we lose our opportunity and chance to prune and mature that area for that specific developmental milestone. So when we have a kid who has cerebral palsy, kids that cannot walk or move properly, when I have a child that is autistic, when we find and diagnose a problem, usually around age 3, the managed care and the belief was the brain is static, there's nothing we can do. So we looked at that person as someone that will never be able to catch up. And this is false. So we give opportunities to the brain, and the brain that cannot, let's say, move the hand, within a month, they may have other possibilities for the brain to learn to move. And we are providing that possibility for that kid. And this lady had all these kids that were actually, the assumption was they can't walk. One of these kids became a runner because she managed to help the kid to run.
Wow.
And this kid, when he was walking, because we denied him at first of the walking experience, was not very good, a little bit wobbly and out of balance, but this kid became a runner and won.
So it's a belief system.
So it is the possibility that you give to the brain cells to keep jumping, pruning, and finding and changing new connections. The brain never dies. But the belief was that at least by age 18, that we get all the cells in our brain, that's when there is nothing we can do. I give you an example. I used 20 years ago when I had a client with any kind of diagnosis, psychological, behavioral, or addiction, I would send my client to a psychiatrist to get medication. Because in my lectures, I would say to drug addicts that from neck up, there is nothing we can do to a brain cell that it's damaged, which is not true. And we would tell them that that's why we mask your symptoms with giving you some medications or drugs, or they would self-medicate themselves for a few hours, but in reality, nothing would change or happen. So the best news that we can give your audience is to know firsthand that when you have a symptom, please don't mask it. That is a valuable information. If you have toothache, you don't keep taking Advil or a pain relief medication. You go to a doctor for an X-ray. Today, we have an opportunity to understand why you have a problem. And this why, because of neuroplasticity, it means that we check the electrical communication of the brain cells, the brain waves, in that certain moment. And it gives us an opportunity to understand why you have a symptom. And each area of the brain has its own responsibility. And if it's not working well for you, then we measure it, we map it, and then you can be treated. It's just fascinating how I have clients that they're not on the spectrum of autism. They don't have ADD problems. And when you give attention to the brain, left and right hemisphere, which we can explain the brain a little bit, but when you manage to bring conformity between left-right hemisphere, the communication becomes wisdom for that person. And that person can have a functional, balanced thoughts, emotions, therefore actions. And one of the things, the second breakthrough that you asked me is a concept we call epigenetic instead of genetic. You know, again, we thought that the DNA is fixed in the brain. So we thought that there is nothing that we can do to change the potential that we were born with. But today we know the DNA, of course, makes us have personality traits. Somebody is shy. Somebody has some mood issues. Somebody maybe has some anxiety. But the rest of it will depend on epigenetics. And epigenetics means everything we're all about in our environment. Our lifestyle, the kind of mother we had, the love relationships, the education, the food we eat, how we take care of ourselves and the toxicity and the toxins around us, and what kind of a habit we have. So we need to start. Prevention is the key. We want to take care of ourselves and our kids and to pay attention to the brain development. And the way that we check our teeth with dental floss, we use toothpaste to clean it. We do the same thing with neurointegration therapy for the brain.
Fascinating. And I love how you say we just don't look at the symptoms and we actually have a cure. This is amazing, and how the epigenetics and the environment affects the brain.
So it's not called cure because we don't have a disease. This is an imbalance. And the imbalance can be balanced with the new scientific breakthrough knowledge that the brain is fluid, it's neuroplastic, and the brain, it's epigenetic. So before I used to say 90% we are a victim of our genes. Today I say 10% we are affected by our genes. 90% is that potential. And if we optimize the brain, then we can get to this healthy lifestyle and a very active brain. Like anything else in life, brain also needs attention, care, and supplements and activity. And we have created this activity, which we call it neurointegration therapy.
Could you also please talk about, you were telling us a bit about the brain and the locations and the right and left hemisphere.
Yes.
I would like to understand that more.
Yes. So the first thing we need to know is that our brain is about 3 pounds and it's extremely fragile, sensitive, and it keeps the trauma easily. So it's about 60 to 70% fat, and we have about 70% water. So one of the things we want to make sure is that we take care of the nutrients of our brain, drink a lot of good alkaline water, and we definitely take care of the oil we need because we don't get enough. And as you know, we have a supplement called DHA, which is a blend of vegetable oil and seaweeds. I do recommend that from age 2 on for prevention and for giving the brain, enough oil. We're like a car and we need all kind of water and oil and we take care of our car more than we take care of our brain.
That's so true, yeah.
So, and the brain controls everything about us, who we are, what we do, how we feel in the morning, if we are angry people or not, and what action we take, and how much we can learn, and what we crave to eat. We truly can be the victim of our brain cells. And the brain consists of 4 lobes. The front of the brain, the frontal cortex, is our CEO. This is the manager of the whole system. So if we have a good frontal lobe, we are a very functional, independent adult in the world. We can manage, make decisions, problem solve, think about a consequence of our action, have a good character, be aware of things, have abstract thinking, and being able to be responsible, attentive people. And memory also is here. The problem with the frontal lobe is that we are born with a lot of cells in the back of the head, which is the occipital, which is the bank of memory and emotion. So any kind of information will become a bank of our memory and it sits there. If we give good information, if I have a kind mom, if I have a good environment, healthy food, no toxicity, and if I'm learning and if I'm doing sports, that's why we do the kids, with them sports, music. If you have great outlets that it's happy, the brain starts pruning and maturing to the front of the brain, but it won't get there until we're around age 20. And that's why kids and teenagers, they're not really functional with making decisions, not get emotional, not get into trouble. And they shouldn't drive, in my opinion, until they're 18. Because if they get emotional, the brain gets hijacked and goes to the first brain in the back. And they deal with the environment with their emotion. And sometimes it's not reasonable decision making, and they can put themselves at risk. Drugs, alcohol, too much electromagnetic field of our tablets, eating junk food, having a traumatic experience, having a fall, everything that it's a little bit traumatic will sit in the back of the head. And that would stop the wiring, the structure, and the way that our brain should move on and mature. That's why a good childhood and a kind mom and having a loving relationship is the base of having a good functional brain. And we know that the first rule of parenting and motherhood is to create the cells of, we have cells of bonding and love that only creates in the brain by age 7 if we have a loving relationship and love connection in our family. So remember that, let's say, I remember vividly on 9/11 where I was. But if you ask me, Nanaz, where you were on 9/10, I have no recollection of it because unfortunately, trauma sits in the brain. And our hope is for everyone to get this maturity to the front of the brain. But if it doesn't, that's where neurointegration therapy comes to help people to get rid of trauma, to prune and mature the brain to the front of the brain, because brain is neuroplastic. And we really can rewire and help that person to have a holistic approach to life and to feel better. The temporal level, the temporal sides are based on all the information of 5 senses comes in from the temporal sides. And that is really important because it brings all the information. Therefore, it pictures are short-term memory and then long-term memory. And it picks up trauma. So when we do a map for people, when we do a brain map, we actually can understand if they had a trauma and how severe the trauma is and what's the damage electrically, and then we can also check it neurobiologically. So we're very careful to help people, and it's interesting that now people that have trauma is physical, emotional, sexual, any type of trauma is trauma. And after any accident, or people have cancer and they're going through chemotherapy, anyone with trauma, they come to us to get rid of this damage and to release good, happy hormones instead of stress hormones, and bring more connections between the front of the brain and the back of the brain to relieve the trauma. And then the top of the head is very interesting. The top of the head deals with all our movements, body movements. So the way when we talk, when we write, when we type, everything that we do that it requires action deals with the top of the head, the sensory cortex. And with people that stutter, people that cannot walk very well, people that have tremor because of Parkinson, any reason, epilepsy, it's all happening because of the lack of communication between the left-right hemisphere or the lack of nutrition in this area. And the parietal area is here, and that deals with our learning. So kids that have learning disability is not a disorder anymore. It's a symptom to tell us that there isn't enough good communication between left and right hemisphere. And when we do the brain math, and when we understand what they need with the right exercise and sound and music and motion and sensors and nutrition, we rewire. So I recommend that people do in general about 6 to 10 sessions of neurofeedback because it lights up the brain and it gives you the opportunity to be the best version of yourself. And also with children, when I help them, they have no learning, writing, reading, math. It's all connected to here. And we can help them to get easy A's. So the brain from the F to the O to the P to the T, it all needs attention and it all needs understanding of why we do what we do. A lot of our accomplishments is because people that have been diagnosed or they're on heavy medications, now they can understand why they have the problem and treat it. In general, brain has two hemispheres. The right hemisphere is our emotion and the left hemisphere is our logic. So we're constantly in a fight between emotion and logic. And on this, we're all on the spectrum. We all have anxiety, we all have depression, we all have ADD, but it's depending on how well the left and right are communicating. And when they don't communicate effectively, then we have a symptom. So we come to Dr. Pirnia, and then we check the symptoms and we understand where we need to exercise and to bring more light, motion, sound, and food to that area. The right hemisphere, which is anxiety, and the left hemisphere, which deals with depression. So now we know the translation of people with anxiety in the world. It means fear and worry about the things that we don't do anything for it. And the amount of stress and fear that accumulates over the years overwhelms the right hemisphere and then shifts to the left hemisphere, and means that depression, that gradually we say this person has chronic depression. So we're taking care of our brain in every area, and we don't have to have a problem to do brain therapy. We want to do it to optimize the brain, and it helps the gut. And as you know, we also have our functional medicine doctor, Dr. Kate, and together we're being able to connect this bridge of communication between the mind, the brain, and the body.
Very interesting. You know, as you were talking, I just came up with a side question. When you said the brain affects our mood, and you know, a lot of people just sometimes blame hormones about the mood. And I just wanted to hear from you. What are your thoughts about that?
So you're bringing a very, very good and important knowledge. Again, we have an amazing breakthrough knowledge. The brain, in order for the cells to connect, They need electrical activity of the brain waves, which we measure it via brain map, which I will explain later. And also we need enough nutrients for our neurotransmitters. So the new word that everyone should know is that the base of us is to have good enough nutrition in between our cells. The brain cells will only communicate if they have enough electrical connection and nutraceutical connection. And when we didn't have this knowledge, when you had anxiety or panic attack, you had to go and get your medication. And still, I don't have anything against medication when it's an acute situation, when, I have my appendix problem, when I have a heart attack. But we're talking about prevention. We're talking about not getting sick. And we're talking about the right diagnosis if we have a symptom. So neurotransmitters now, they can be evaluated with a nutraceutical lab instead of pharmaceutical lab. How it works is that we use your saliva, urine, blood, all of them or one of them, depending on what we think you need. And we send the sample to this nutraceutical lab from around the world. This is the only way that we can understand what enzymes, amino acids, minerals, what deficiencies of vitamin and hormones we have. So we are born obviously with some deficiencies. When we could not measure it like this with the urine or saliva, we had to, and we thought the brain is not fluid and is not going to connect. We had the wonderful psychotropic and all these pharmaceutical recipes. But the pharmaceutical recipes only mask the problem. It does not give you the nutrients that you need to function. And that's why when you take a medication in a few hours, when it fades out, then you need more of it, then you don't feel good. And that's how habits and addictions form in the brain. And also you don't really tackle the root cause. So nutraceutical lab, it's another suggestion for me to your audience that no matter where they live, the least we can do for our kids, any age, up to 130 years old, to understand the nutritional imbalances in our brain for better communication. And the reason we're successful with neurointegration therapy, the reason I'm successful with treating all these symptoms is because of this knowledge that I can send this sample and the nutraceutical lab will design the few supplements that you need, how to take it, when to take it. So we don't want to just go to GNC or Whole Food or just randomly take all these vitamins and minerals. And with the COVID, people have learned much more about prevention, about immune system. Now they hear about DHA and B complex and how to take care of themselves. And this is something that not necessarily only because of a pandemic we want to take care. We would like to give the brain enough nutrients and support. So when I do a few sessions of neurofeedback, the brain really connects and rewires. And the good news is that when we are reaching that point, it's actually the maintenance is there, but it's forever. So it's something that we really change in the brain, and it's not because of some drugs or medications. It's not a false connection.
This actually brings me to my next question, is that what is your approach to diagnose and treat your patients? And when you say neurofeedback, can you explain what is a neurofeedback, how it's done?
Yes. So the first thing I do when I see you or we have a Zoom session, if people are around the world, is we're going to understand all the symptoms and I do a full evaluation. I can say most of the time, a few sessions of therapy is really important because the psyche and the thoughts run our world. When you wake up in the morning, if you say it's a bad day or a good day, it will depend on your thoughts and how you have accumulated your experiences in life and how much trauma you have and what complexes you have. So psychotherapy and evaluation. And then we do what we call QEEG. It's called quantitative EEG. It's like a quick motion picture of the electrical activities of our brain. So it's a very easy procedure, non-invasive. It has no x-rays. It's easily done for kids and adults. And I do recommend a QEEG brain map for everyone, the same way that you understand the teeth, you understand, you x-ray or do an MRI to understand the gut or any problem you have. You do a QEEG brain map to understand your brain. Once we give this, when you sit in front of this computer, eyes closed and eyes open, we send the information of this electrical activity to our neurologist, and they translate the data and they send us a report. It's a colorful chart about you. I always say it's like fortune telling. So we see the amount of anxiety, depression, emotions. We can predict if you will have Alzheimer or dementia in the future or not, and we can reverse that. And then we can detect all the learning issues you may have with reading and math and short-term, long-term memory and attention for ADD patients or people that feel that they don't have enough concentration. So we get this information and our neurologists design this individualized program for you. And we know exactly now what to do and what color light your brain needs. You know, light travels through the body and the brain. And I do recommend you and everyone to walk outside, get some light to the brain every day. So we decide on the light, we put a glasses on you, and we put the sensor, which is just on the skin, in the areas that we think there isn't enough activity and communication. You sit in front of a screen and you watch your favorite movie. Brain only reconnects if the information that comes in is happy. Isn't that interesting? So we have to make it happy without any stress. You watch a movie, but you're the mouse. And instead of using a mouse, we're using that area of the brain that runs the movie for you. So you're watching a movie, and if your brain has enough oxygenation and activity in that area, that specific area, the movie runs smoothly. If not, the movie gets a little bit faded or lower volume, and the feedback that it gives you starts this reaction, this unconscious reaction of us to work out to watch the movie. And with this pleasant environment, this physical activity happens in the brain and gradually it rewires. And then we give you the right amount of nutrients you need, and we combine our neurofeedback with light motion. We created a motion bed, and this motion bed is like a baby in the womb. And the motion of the mommy's stomach and the movement of left, right, left, that is very soothing to the brain. With that emotion and the proper light and specific sounds that releases happy hormones in you and gets rid of the cortisol, anxiety hormone in the brain, and that relaxation, you give an opportunity for the brain to rewire, and you become relaxed, anxiety free, get rid of the depression, and in psychotherapy, to put the inner self, work on your better self, to feel good about yourself, to feel important, and to feel deserving. Because most people, when they come to see me, they have an issue with control and balance in their lives. And that control and balance is not only happen, the change happen in psychotherapy, but the brain also needs the attention. So this combination, which I want to tell you that it's very unique, and we won a lot of awards because of it. It's truly a breakthrough workout for everyone's brain.
Yeah, and I just wanted to mention that it is not something that we do the rest of our lives. It's a treatment for a certain period of time, and then people will just, right?
So in order to get rid of the symptoms, you come and see me. But remember that what we're offering to you, it's a brain exercise. So for us to say for the rest of our life, we're not going to go to a gym because we have our ideal weight is not right. So we teach you how to keep the brain busy, and we have a few home units that we recommend everyone to use from age 2 and up. One of the home units, it's the Alpha machine. I recommend for all your audience to order one, and I give a special discount to your audience. But this Alpha unit is, I wish I created this. Based on the information that we have now, we know that our earlobes are the antenna to the brain. And as you know, Sikhs in India, or when they do acupuncture, they work on your earlobes. And because we don't have time to massage our earlobes for hours, he created this, and it's simply non-invasive, and it only works with massage. So I put this on, the massage creates heat, and the heat creates a microcurrent energy between left and right hemisphere, lifts depression, lifts anxiety, and it helps memory 30% increase. So the kids that if they have a test, let's say, the night before, when they use the alpha for 20 minutes, the next day they have better recollection and memory to do the test with less anxiety. So this is maintenance. This is something that now we're privileged to have. And it's interesting, Reda, that when it releases that energy, it releases our own opioids in our brain. So this equals drinking wine. One glass, two, three, and if you keep it on, you can sleep with it. So this can be a sleep aid. And the other benefit of this is that the electromagnetic field is a big problem and is a big scratcher to our brain. And our kids are overwhelmed, and they're sitting hours in front of the computer, laptops, and they're constantly getting this electromagnetic nonsense. And using 20 minutes of alpha every day, it keeps that waves away. And we know that people will not get a lot of types of cancer. So we want to learn to take care of ourselves. And now we have this instrument, as you know, we also have the brain tap, and it has the blue light, which blue light is life for the cells. And it has motion, light, sound, and we have an app, and we send this to people. They use the app, and they use the thing that is closest to their need. So if they have stress, if they just want to relax, if they have ADD, if they need some hypnotherapy, we added all the right suggestions for people to get rid of a habit or to feel better. So things like this will help us to optimize the brain and stay away from any disorder, really.
Thank you so much, Dr. Pernia. Very interesting information and really a true pleasure to interview you.
And thank you so much. The only thing I want to add is, besides everything I do for the brain, we are responsible to eat right and to sleep enough, because it's only when we have the right food that the brain works for us. And it's only when we sleep that the brain gets that opportunity to rewire for us. So live well, laugh, love your kids, love your family, and enjoy the life. When you celebrate your life, the brain gets celebrated.